Good evening, and thank you for the opportunity to introduce myself to you. I'm planning to work with Sonica in a salon in Van der Bijl Park, and she asked me to make a quick video just to introduce myself and tell you people what I can do and who I am. All right, I was a dentist in Alberton for 33 years. I started in 1986 and I closed my dental practice in 2019. But the way it went for me, it's in 2010, my daughter finished her medical somatology course, and she started a beauty salon just next to my practice. And it wasn't long after that, and she asked me to do Botox for her clients. I didn't know about Botox, I didn't know anything about these things, and I did my first course in Pretoria with Dr. Chris Giesing, and then I started treating her patients, and I realized that I'm working on the frame around the mouth. The mouth was obvious my special interest at that stage, but I was working on the frame around the mouth. Now I could improve the frame around the mouth, and that got me into this whole business. And but I realized that very soon I realized that you cannot fix everything with Botox. It's like a friend of mine said to me once, Willie, if you only have a hammer in your toolbox, then every problem will look like a nail. And I decided that I've just got Botox in my toolbox, so every problem will look like a ploy or a line. So I started, at that stage I was just doing Botox, and I bought myself some more books from Germany about Botox. The first book I bought was the medical applications of Botox. This is actually where Botox started, where an eye specialist injected Botox into a child's eye that was slightly skew, and the muscle pulled the eye slightly, one muscle pulled the eye slightly skew, so they injected the Botox in the stronger muscle and the eye aligned again. That was the first application of Botox ever. And then I bought another book, well, I bought it at the same time actually, the aesthetic applications of Botox. Now that's for the frown lines, the crow's feet and all these things. This is what I use most of my Botox treatments for, is from the medical aesthetic, from the aesthetic side. But I also do the medical side with sweating, clenching, and other kinds of problems. And after that, after the Botox, I did my first course in fillers, and I did some more advanced courses in the fillers, and then eventually I got onto this course, the 8-dimensional lip design. And this I love, and this is the way to go if you want to do lips with fillers. Then what else is there? Yeah, from my dental days I used PRF, and not a lot of people know what PRF is, but it's platelet rich fibrin, and this is the book about that. It's platelet rich fibrin. Now what this is if the patient needs, say my dental patients needed bone for an implant and they don't have the bone, I would draw their blood, spin it off in this machine here, and then the top part is your platelet rich fibrin, the clear plasma part that contains platelet rich fibrin. You work that back into the mouth, where the bone used to be, and you build back the bone like that, and 4 to 6 months later you can place your implant, no problem. I love that treatment. Then in 2019 the people realized that this could also be used in facial aesthetics, and this has got a big place in facial aesthetics. But I'll tell you that in a different video. I'll tell you more about that in a different video. And what else do? I do Ciccarelli. Ciccarelli is a lipolytic solution. Lipolytic means it dissolves fat, and we use that for stubborn areas where if you lose weight, you don't lose that fat, and we can control it and dissolve it with a lipolytic Ciccarelli solution. And I also use a plasma machine, which is a plexer, to melt away, what do you call it, moosies, skin tags, and warts, stuff like that. I've just did a wart for my wife, she's on her toe now. And also lines that have became permanent, you can soften them with a plexer machine, and you can also treat do a blepharoplasty, where you treat hooded eyes to make that, you know, where the eyelid hangs a little bit, start to hang as we get older. You treat that with a plexer, and that softens it and it pulls it tight again. Yeah, that is what we use to make people beautiful and younger looking again. Alright, and I hope I'll be able to do that for you guys. I hope I'll be able to work nicely with you guys and give you the best I can, and help Sonica in her salon, and I think I'm going to enjoy that. And I'm looking forward to meeting you guys and helping you guys with the same type of things that I've been doing down here in Mossel Bay, or in Dana Bay where I'm staying. Alright, I hope to see you soon, and have a nice evening, and have a good evening. Cheers, bye bye.